All of you. With the permission of the chair, if I have the permission of the chair, I would request all the delegates who are present here to put their mobiles on the silent mode because we're capturing every moment of this inaugural function. Every second is being captured. This is very humbly requested to all of you. Thank you. Dr. Nuzat, please.
In the name of Allah, the most gracious, the compassionate, Assalamu alaikum, and wishing you a very good afternoon. It gives me immense pleasure to extend to you a very warm welcome to the inaugural program of 5-day workshop on Epibiostat, integrating epidemiology and biostatistics for implementation research and policy planning in One Health. The workshop is organized by the Division of Veterinary Epidemiology and Preventive Medicine, Faculty of Veterinary Science, SKUAST Kashmir. It is our proud privilege and honor to welcome our distinguished chief guest, Honorable Vice Chancellor, SKUAST Kashmir, Professor Nazir Ahmed Ganai, kindly gracing the inaugural session. We are delighted to welcome our special guest, esteemed Director, SKIMS Sora Srinagar, Dr. Parvez A. Cole as guest of honor. A warm welcome to our guest expert, Dr. Shaiban Moore, reader in One Health at University of Liverpool, United Kingdom, jointly appointed scientist at International Livestock Research Institute, Ethiopia. We have with us special guest, esteemed Director ICAR, Navedi Dr. B.R. Gulati, esteemed Director Extension SKUAST Kashmir, Dr. D.M. Magdumi, sir. Our revered Dean, Faculty of Veterinary Science, Dr. Mohammad Tufail Bande. We have special guest, Head Community Medicine, GMC Srinagar, Dr. S.M. Salim Khan. Respected heads of the faculty, other faculty members, and a warm welcome to our enthusiastic participants gathered from different sections across different parts of the country. We welcome you again with a warm, we again welcome you. Now, to commence the workshop, may I request the revered Dean, Faculty of Veterinary Science, Professor Mohammad Tufail Bande, sir, onto the stage to deliver the welcome address.
Assalamu alaikum and good afternoon, everybody. I'm extremely delighted to welcome our chief guest of today's function, Honorable Vice Chancellor, Professor Nazir Ahmed Ganai. I feel privileged to welcome guest of honor, Professor Parvez Ahmed Cole, Director SKIMS. I also welcome Director ICR, Navy, Dr. B.R. Gulati. I also welcome Director Extension SKUAST Kashmir, Dr. Dilmad Magdumi. I welcome our special guest, Dr. Shaiban Moore, Reader, One Health, University of Liverpool. I also welcome Dr. S.M. Salim, Head Community Medicine, GMC Srinagar. Welcome to all the officers of SKUAST, HODs of Faculty of Veterinary Sciences, and officers of Department of Animal and Sheep Husbandry. Well, we have gathered here today afternoon for the inaugural program related to the One Health program for integrating the epidemiology and biostatistics for implementation of research and policy planning. Few days back, we had a healthy interaction between the various stakeholders involved from various faculties, the experts from GMC, experts from our veterinary faculty, experts from agriculture faculty, experts from fisheries science, and experts from sericulture. On that occasion, the feedback was also received from the participants and delegates and the scientists. And I hope during the program, still more suggestions will be received from the speakers so that the implementation of this program can be taken care. Thank you very much, one and all.
Thank you so much, sir. May I now request Dean Faculty of Veterinary Science to offer flowers and felicitate the chief guest of the event, Honorable Vice Chancellor Professor Nazir Ahmed Ganai. Thank you, sir. Thank you so much. May I again request worthy Dean Faculty of Veterinary Science to present flowers and felicitate guest of honor, esteemed Director SKIMS, Dr. Parvez Ekol. Thank you so much, sir. I may now request Honorable Vice Chancellor SKUAST Kashmir to present flowers and felicitate our guest expert, Dr. Shaiban Moore. Thank you so much, sir. Thank you so much, sir. I would like to request Professor Shardar, sir, Head Division of Veterinary Parasitology, to present flowers and felicitate our esteemed Director Extension, SKUAST Kashmir, Dr. D. M. Makhdoumi, sir. Thank you so much, sir. May I request now Dr. Abdul Hai to offer flowers and felicitate our Director, Nibedi B.R. Gulati, sir. Dr. B.R. Gulati. Thank you so much, sir. May I now request Dr. Ejaz Ahmedar to felicitate and present flowers to Dean Faculty of Veterinary Science. Thank you, Dr. Ejaz. May I now request Dr. Azmat Alam Khan, sir, co-PI NAHEP and OSD to Vice Chancellor to
Oh, yes.
to present flowers to Head of Community Medicine, GMC Srinagar, Dr. Salim Khan. May I now call upon Dr. Shahnaz Bashir, Assistant Professor, Division of Veterinary Epidemiology and Preventive Medicine, to present flowers and felicitate Dr. Azmat Alam Khan, sir. Thank you, Dr. Shahnaz. May I now call upon Dr. Ejaz Ahmed Dar, Organizing Secretary of the workshop, to present the overview of the workshop.
Thank you, Nuzat. Honorable Vice Chancellor, SKUAST Kashmir, the chief guest of today's function, Professor Nazir Ahmad Ganai Saab. Guest of honor for today's function, Professor Parvez Ahmed Kol Saab, Director SIKIMS. We have with us the Director Extension, Professor Dilman Magdumi Saab. Show more reader One Health, University of Liverpool, Dr. Gulati Saab, who is ICR Director, ICR Nivedi, Dr. SM Salim Saab, Head Community Medicine, Dean Faculty of Veterinary Sciences, heads of the divisions, colleagues, dear participants who came from across different states of the country from various disciplines to attend this 5-day workshop. This workshop is basically meant to integrate veterinary epidemiology and biostatistics, and with the aim that somehow we'll discuss and deliberate that how we can institute School of One Health in SKUAST Kashmir to develop a roadmap. And second objective of this workshop is to enhance the skill set of the students, of the participants in epidemiological softwares and then statistical tools, so that whatever data we collect, we should be able to refine that, filter that, and then interpret the results. We have participants from the Gadwasu, Ludhiana. We have participants from Central University of Kashmir, then College of Fishery Sciences. We have from different disciplines of this veterinary college. So I believe that the nature of the participants is itself the One Health. And earlier to that, on the Friday, very Friday, when Honorable Vice Chancellor joined us through the virtual mode, we had an interactive session where we had called upon all the relevant stakeholders for the One Health, and we had a very, very fruitful discussion. And the suggestions we have received that, and the feedback from we have received, that quite clearly indicates that everybody agrees. We don't even one person is that who is differing from that opinion. 100% of the people who participated agreed that SKUAST Kashmir should establish the School of One Health, along with the collaborators in the medical sciences, the other stakeholders, be it the environmental sciences or other aspects. So we have also kept that declaration form, that SKUAST Kashmir Declaration of One Health, in the folders, and I'm sure that it will be done by Honorable Vice Chancellor and the dignitaries. So this 5-day workshop, I'm sure that the participants will show keen interest in this, and when you will go back home, and you will be very learned in epidemiology and use of biostatistical softwares, tools, and softwares. With these words, I thank you. I thank Honorable Vice Chancellor, sir, basically for guiding us, for encouraging us, and for motivating us for doing such out-of-box tasks. And I also thank Professor Parvez Ahmed Kol Saab and SM Salim Saab, who we are basically entering into an MOU. We are inking an MOU with the director, with the SKIMS and GMC Srinagar as well. Thank you very much.
Thank you, Dr. Ejaz. Now it's time to unwind the Declaration on One Health. For this, may I take the privilege to request distinguished Chief Guest, Honorable Vice Chancellor, SKUAST Kashmir, and other revered dignitaries to release the SKUAST Kashmir Declaration on One Health. Please, sir. It is dignitaries also, dignitaries also.
Dignitaries.
Brief. To brief. Done.
Sorry.
Just again, speaking. Thank you so much. Thank you all the esteemed dignitaries for such a memorable part of the event. May I now call upon our guest expert, Dr. Shaban Moore, to address the gathering.
Thank you very much. It gives me great honor to be here today, and particularly to witness the signing of the declaration. Honorable Vice Chancellor, esteemed guests, faculty members, and students, all important students. I have come here today to tell you a little bit about my visit from the University of Liverpool and the International Livestock Research Institute in Ethiopia. So within my institution, One Health sits within what's called the Institute for Infection, Veterinary and Ecological Sciences. And we aspire to be a leading institute for research that improves human, animal and environmental health, otherwise known as One Health. So much of the research that we conduct in the Institute is very much focused on the kinds of problems that you'll be tackling here as well, along the lines of emerging infectious diseases, zoonoses, AMR, and also health in a changing climate. We have 2 campuses in the UK, and we also have numerous faculty members that are stationed overseas. And so I'm one of those faculty members who's based in Ethiopia full-time at the International Livestock Research Institute. And we do that because we like to have an impact in countries that don't have as much capacity as the UK. And we like to build partnerships that are of strategic importance to both parties that help support capacity building in both directions. Within ILRI, One Health sits within the Animal and Human Health Program, and under that we have numerous capacity building projects, largely around research capacity as well as government-related capacity building, particularly around the areas of antimicrobial resistance, food safety, and zoonoses. Where I sit, though, is focused on operationalizing One Health, and my particular interest is on implementation of One Health approaches at different levels. So, for example, one of my projects is specifically looking at One Health service delivery to pastoralists who might otherwise not have access to health and veterinary services. So I've been embedded in Ethiopia for 5 years now. And that's really one of the reasons why I wanted to come here and visit when Dr. Ijaz reached out to me, because I know how important it is to understand the local context as you start to understand the kinds of partnerships you might like to build. So I've been here since Friday and really been learning about the initiative that you've been developing in One Health. I've had a tour of the veterinary campus, and on Friday we also had an interactive discussion. You might see I'm famous with all of the posters around the place. Quite unusual in my context. But the thing that really struck me on Friday was the diversity of the skills and knowledge base that you have at this university. There were some areas that were particularly important, like plant health and ecotoxicology, which are areas that are really important for One Health, but which have been underrepresented in One Health domains globally. So I think you are positioning yourselves strongly to really address an area that has been neglected within the One Health sphere. I also had the privilege of traveling to Palagan, which is beyond words. I found myself really struck by the beauty and not being able to really explain what was coming up in me. Partly, as I said, that was because I think we were listening to Bollywood music and there was a mixture of emotions happening as I was looking at the beauty. But it gave me some insight into your local landscapes and the way in which health happens in those landscapes. So we saw lots of interaction between humans and horses in the context of tourists and people who are transporting and trading with the border. I'm told that the pilgrims are also using horses. We also saw a lot of shepherds managing their small ruminants in that kind of context. So it gave me some sense for locally what the system looks like. I had read before I came here about the hospitality in Kashmir. And I think until now, I did not know what the word hospitality meant. I have been treated like I had never expected. And I really wanted to thank you, Ejaz, Pervez, and Idris. I think I saw down here. Yes. You know, not only were you kind and helpful, you were actually really comforting and just really great to be around. So thank you very much. Your kindness and caring just really came across and has really made my visit. So where do we go from here? I'm going away loaded with ideas about areas of mutual interest. We'll continue the conversation around possible areas for collaboration, particularly around research collaboration. I see opportunities, particularly in AMR and also in vector-borne disease-related challenges based on some of these conversations and skills that we have back in Liverpool. I also think that there's lots of potential to engage in short course development, building on some of the models that we've used in Africa context and also helping to support the university in having outreach and extension activities. And so these are all things that we'll continue to discuss and I'll work with you, Dr. Ejaz, to hopefully head in the direction of an MOU as well. And then next time we'll be signing the MOU and other people will be coming here. Thank you very much.
Thank you, Dr. Moore, for sharing your experience that you gained from the Kashmir visit. Hope it was memorable and awesome, as you said. May I now request Head Community Medicine, GMC Srinagar, Dr. SM Salim Khan, for a brief address.
Assalamu alaikum and very good afternoon. So we have been a bit late, so I will be much more brief. Respected Vice Chancellor, SKUAST Kashmir, Dr. Nazir Ahmed Ganai Sahab, Professor Pervez Kul sir, and Director Schemes and Ex-Officio Secretary, Deans and Directors of various centers and divisions of SKUAST, my dear faculty colleagues from SKUAST, Shohama, dear students. It's my privilege to be here and I thank Ejaz Sahab for being a very good host all over. Once we talk of the One Health, I found some disconnect between the three components: the animal health, the human health, and the environment. So, but COVID gave us a chance to be together, and I believe COVID has set up a way ahead. Once we look at the COVID-19, we know, being a nodal officer of COVID-19 for GMC Srinagar, how we struggled in sending the samples, even when SKIMS didn't have the lab. So then SKIMS came up with lab, and then GMC also started with lab, and then we start looking for various equipment, be it RT-PCR or refrigerated centrifuge, and we visited the center also to find if we can get some more. Then after we had a lot of capacity building with VRDLs and all those things, but I still believe that COVID gave us a chance to come together and move together. And I believe today's workshop is a way forward for such type of activities. Because as of now, we have been living in silos and we don't know what type of activities or research is being carried out at various institutions, be it in human health or animal health or in the environmental health. So I take an opportunity this time that we should form, we request our Vice Chancellor Sir and Director Schemes also, that we should form a consortium of One Health in Kashmir, at least so that we come together and start working from this day. So this. And secondly, I would like to suggest that as MBBS students, we take them to various institutions of public health importance. And I believe, if allowed, we shall bring students to Shohama also and let them see how things are being carried out. So we should not be just, because in our community medicine, we take them for field visits all along various places of public health importance, be it health centers, water treatment plants, and sewage treatment plant, and other facilities, food establishment labs, all those things. I believe bringing them here will open new vistas of understanding the dynamics of disease, because as we know that zoonotic disease are responsible for over 60 to 70% of all communicable disease in humans. And we need to understand the transmission of diseases at the animal level, then at the human level. And for that, I believe this is the right time to understand, because we know that the biggest pandemic going on nowadays, the hidden one, apart from what we saw during COVID times, which was evident, is antimicrobial resistance. And it all starts from the animal life itself. So we need to address those issues from that level. We know the effects of using of diclofenac among the veterinary and the outfall of on vultures and how it changed the ecosystem. So we need to work together. And for that, I reiterate my request that we should form a consortium where all, at least the animal health and the human health, shall come together, and bringing all allied specialities concerned with the environment. So we form a One Health consortium in Kashmir. Thank you very much.
Thank you so much, sir, for your valuable information. We have here with us esteemed Director ICR Navedi, Dr. B.R. Gulati, sir. I request you, sir, to kindly address the audience and enlighten us with your experience.
Honorable Vice Chancellor of this beautiful university, Professor Nazir Ganai, Dr. Pervez Kaul, Director SKIMS Kashmir, officers of this university, participants in the training on Epibiostat from different parts of India, ladies and gentlemen. Assalamu alaikum, good afternoon. It is in fact a pleasure and privilege for me to be part of this August gathering and to be part of this training program on Epibiostat. In fact, the name of this training was so fascinating. Being the part of institute called National Institute of Veterinary Epidemiology and Disease Informatics, I could not resist myself coming over here and be part of this training program. So I thank the organizers for inviting me. In fact, during last few years, we have seen the emergence of many livestock diseases. Previously, we were seeing that every 2 years, one disease is coming. Now, for last 3-4 years, we are seeing every 1 year, new disease is coming. 2019, we witnessed the incursion of lumpy skin disease. 2020, we saw the African swine fever. Then 2021, we saw the monkeypox, and many more are in the line. And the pandemic of COVID-19 has given us the experience that data is very valuable in managing the disease, preventing the disease spread, and controlling the disease. And hence, the disease data on livestock diseases play a crucial role in managing, preventing their spread, controlling their, and eradicating them. So that is where the role of epidemiologists and biostatisticians come. And unfortunately, our country is having very shortage of manpower on trained manpower on epidemiology and biostatistics. So such trainings will provide the competence to the manpower for managing the large disease data. As we are experiencing the outbreak of diseases like lumpy skin disease, which came in 2019, reported from Orissa, and from there, within a year and a half, spread to more than 24 states. And it has so far affected more than 35 lakh cattle and caused mortality of more than 2 lakh cattle, which is reported. And probably reporting is now never complete. Always it is under-reporting, misreporting, or non-reporting. So these are the problems with the disease data, where the epidemiologists and the people involved in disease diagnosis, disease surveillance and monitoring have the critical role to play. Because of this lumpy skin disease, India has suffered an economic loss of more than 1 lakh crore in all the 24 states. We have done this is just the estimate, we have done the systematic estimate of few states. In Rajasthan, we found it cost the country 2,413 crore rupees. In Gujarat, it costed to the country 1,850 crore rupees. So this is one of the largest devastating disease we are facing after FMD or rinderpest we saw in previous century. So diseases are playing havoc, maybe because of change in climate, global warming, or maybe because of the population rise, both of animals as well as human beings, resulting into greater competition between wildlife, livestock, as well as human population for the food and habitat. And because of this greater interaction, we are encountering more diseases. This is coupled with the international and national movements, which is resulting in the spread of diseases. In no time, we report the disease in our country, which was maybe in China or Mongolia, and within no time, it enters into India. We experienced this in case of African swine fever, which was never beyond Africa, but within last few years, it came from China, Mongolia, and entered into India in 2020. And it has destroyed the entire pig industry in India, and that is a great loss to the swine industry. So such kind of diseases need a greater role of epidemiologist, greater role of biostatistician in data analytics, and coupled with the latest development in the field of information technology and communication. Government of India has developed a system called National Digital Livestock Mission. Under this Digital Livestock Mission, an app and an infrastructure has been developed, which is cloud computing based, wherein the real-time disease reporting along with the other health parameters is being done. This has been already implemented in the country. One disease that is being reported on this NDLM portal is the foot and mouth disease. And now, within a year, we want to shift entirely to this National Digital Livestock Mission for disease reporting for all the diseases, including OPD that is being done by the field veterinarian, will be on this portal that will result in real-time reporting, and the problems related with the reporting will be addressed to greater extent because it will be mandatory on the part of field frontline workers or veterinarians to report, to generate OPD on the this portal rather than the paper pen OPD. And with this digital OPD, that will be directly data will be shared with the DHT or the institutes like Nivedi, and real-time reporting will sort out the problems associated with reporting. But then there is more need of analyzing the data. So data analytics, data informatics is one area where we need to train our manpower. We need to develop more competence because big data of diseases need big data analytics, and big data analytics needs lot of disease modeling. And for this, we need to conduct more of these kind of trainings and train the manpower. I compliment SKUAST for taking the initiative in this kind of trainings, and I hope that with this, we will be more equipped to handle the big disease data and generate useful information that will be helping our policymakers in decision support system and allocating more resources for management, control, and eradication of livestock diseases. So I wish all the best to all the organizers of this training. Thank you very much.
Thank you so much, sir, for your informative address. We'll also acknowledge that earlier in the day, your expert lecture was very informative. Thank you so much, sir. May I request the esteemed Director, Extension SKUAST Kashmir, Professor D.M. Makhdoumi, sir, to share his valuable visions and thoughts.
Honorable and beautiful Vice Chancellor of this beautiful university, Professor Nazir Ahmad Ganai, equally smart Director, Sher-e Kashmir Institute of Medical Sciences, Professor Parvez Ahmad Koal, working smartly for the institute. We have Simon Moore, our honored guest from the foreign, and we have Dr. Gulhati from ICR system, Dr. Salim, Dean Faculty of Veterinary Sciences, Professor Tufail, many my colleagues, faculty members. I could see some of the alumnus whom I could recognize after 30 years as well, now officers in the line department. Dear students, a very good afternoon and assalamu alaikum to you all. It's in fact a matter of pleasure that we have signed the SKUAST declaration here. Better late than never. But I must tell you, the part that has been played, that has been documented in this declaration, I feel most of that Honorable Vice Chancellor has started from the Shalimar campus, and we have initiated, in fact, that part. I will add to Dr. Salim from GMC says that when talk of the One Health, we have to see the health of health of animals and environment. But sir, I see the health of plants in agriculture is still more important component. I will tell you, sir, just to watch an example, of course, a very emotional example. The shabby looking and dimly lit railway station of Bathinda in Punjab state of India comes to the light at 9 p.m. when a passenger train arrives at the platform number 2, and that passenger train, unfortunate train, that leaves for Bikaner in the state of Rajasthan in India at 9:25 p.m. After traveling 326 kilometers from Bathinda to Bikaner, crossing over 26 halts, it reaches in the morning at 6 a.m. with the unfortunate passengers of the train. Among us whom the 60% of the passengers are cancer patients. So the train has been named as a cancer train because in Punjab, they don't get the sufficient treatment or the cheaper treatment possible. That's why they go boarding this train. The ticket cost is 210 rupees, but government has been kind enough to waive off the ticket fare for the cancer patients and give 75% relaxation to the accompanying persons for the ticket costs. What's the reason behind growth, the increase in number of such cancers? I substantiate the statement which has been given that there is always overuse of the pesticides at the cost of increased production in agriculture and indiscriminate use of pesticides, fertilizers that equally result in development of the cancers in such cases. Many efforts have been taken since the day the data has come to the light. Government of India has taken the initiative just to promote this One Health policy, just to save the environment, just save the life of the animals, just save the life of the human beings. Government of India has launched many smart techniques. And I am thankful to my Honorable Vice Chancellor that ours is the first university in whole of the North India that have launched the drones in agriculture. What could be the possible advantage of the drones? Where you could use 490 liters of pesticide for a field that's just being replaced by 9 liters of pesticide. So the other pesticide that used, soil and environment, that used to be inhaled by the people who work in the fields, giving them the overexposure of these pesticides. So you can see how this drone technology in precision agriculture is going to help us in One Health program. The One Health program, again, we were talking of the antimicrobial resistance, zoonosis. I, being a veterinary clinician, do have a lot of experience in handling our veterinary hospital, especially during the time when it's a very odd time for Kashmir. I didn't have the enough, gear to put on use. With the result, many of my younger staff suffered from different types of the brucellosis or else other zoonotic diseases. But my first observation was conveyed to Professor Cole some 15 years back on telephone. Sir, I have my staff, 3 number, suffering with brucellosis. I know the drug of choice is the tetracyclines, but sir, they are resistant to the tetracyclines because most often we give in the animal is the tetracycline. So it was Professor Parvez Cole who has suggested me the combination of other antibiotics that I could go for. So this thing was seen long ago, that we have to have some convergence at a point where we could say, yes, we should promote One Health program. In this One Health program, not only the aspects of environment or pollution, water, we are the inhabitants of a place that is a place of Sufism. That is a place where we have been taught in our childhood. I salute my teacher in school who told me, don't urinate in the water body. Don't urinate near the root of a tree. So today we see the all excretory metabolites that come out of the urine. They given to the tree get absorbed. That may be fatal. What is fatal for the human life can equally be the fatal for the plant and animal life. We have got to prevent the transmission of the infections from one species to another. This was given to us by our teachers, and we have been practicing that. Our Prophet Muhammad, peace be upon him, kept himself hostage for a deer, for an animal. What was the reason? It was the preservation and conservation of the species of animals. So we have not to overexploit the environment, the resources, because we see for our Sufism, all these such endowments, maybe it's plants, maybe it's animals, maybe it's hills, trees, streams, rivers, everything is a prerequisite and mandatory for maintenance of the whole environment, ecosystem, and One Health. I hope we will keep that in view and the scientific data with us and carry it forward. Whatever we have signed it today, I feel we will bring it to the practice, one and all. Thank you very much, and thank you all.
Thank you so much, sir, for your words of guidance and information. To foster academics and research collaboration with other institutions that would in turn lead towards more efficient and innovative ways to solve problems efficiently as far as One Health is concerned. For this, three memorandum of understandings will be signed between SKUAST Kashmir with Sher Kashmir Institute of Medical Science, SORA, Government Medical College, Srinagar, and third one is National Institute of Veterinary Epidemiology and Disease Informatics, ICR, Navedi ICR. May I take the privilege to invite our Honorable Vice Chancellor, Sir, Professor Nazir Ahmed Ganai, Sir, for signing these MOUs with these three institutions. It is indeed a proud moment, and for this, we are immensely thankful to all the eminent personalities gracing the event. Thank you all. Thank you so much. We are delighted to have with us Director SKIMS Sora Srinagar, Dr. Parvez A. Kaul, known for his immense contribution to academics and research. May I request you, sir, to kindly address the gathering and share your words, precious words of and message.
Professor Nazir Ganai, VC for SKUAST Kashmir. Dr. Shobin Moore, pardon me if I pronounced it wrong. So, Dr. Gulati, Director Extension, Dr. Dilmohon Nagdumi, Dr. Tufail Bhande sir, Dr. Salim Khan, faculty of the various colleges associated with SKUAST Kashmir, ladies and gentlemen, it's indeed a privilege to be here amongst all of you on the eve of this Epibiostat workshop, wherein you have integrated two components of having inked an MOU with important stakeholders that are present in the state who could contribute to the amalgam that is fostered for the concept of One Health, which is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, the animals, and the ecosystem. We all know that we live in an environment which is interdependable, and we have talked enough on that. Everything depends on the other. People talk a lot about COVID. Yes, that gave us probably the biggest boost of this current century. But we must also keep in mind the largest infectious disease disaster, that of bubonic plague, that consumed nearly 200 million lives. The Spanish, or call it the Indian flu of 1918, anything between 50 to 100 million lives consumed. Now COVID, 69 million lives. So there has been always something that is rooted in the animals, and from where it jumps species and gets onto the humans. And there lay the importance of the One Health approach that we are talking about, and developing a school of One Health under the auspices of SKUAST-Kashmir. Dr. Dilman Makhdoumi talked about plant health. Yes, we see a lot of pesticide exposure. We see a lot of, we in the medical field see a lot of patients taking, and this is one of the regions in the world where we have the highest incidence of organophosphate poisoning. And that is how we see organophosphates that you use in your pesticides. People use it for suicidal intent, or they can have it in an accidental fashion and get to, themselves to us. Long back, I used to work a lot on hydrated disease of the lung, and we know that liver is the commonest site of infection in the humans, and we know it can come as an incidental finding on a radiograph of the chest, or it may come with cough, it may come with blood in your sputum, it may come with chest pain, and we would invariably subject him to surgery. We tried some certain medical management measures, also tried various procedures in order to drain the lung cyst. However, man is only an accidental host. The definitive host is the dog. So animal health is important. And when we talk of curbing something like a hydrated disease, you talk of vaccinating the dogs. We don't talk of anything for the humans. So it's extremely important for us to understand that we are totally interdependent on each other. 75% of emerging human infectious diseases that resulted in outbreaks in the last 3 decades originated in animals, originated in vectors, originated in be it pangolins, be it swine, be it any other animal. And we are going to have a huge population explosion of the world. We expect the population to be nearly 9 billion by 2050. And we have to have adequate healthcare, adequate food supplies, adequate water for this growing global population. And that is where we need to understand the interdependence of human and natural systems and promote interdisciplinary collaboration. Some of the global issues that One Health works to address include environmental contamination. We have pollution that kills so many people. We demonstrated that pollution contributes to a significant number of diabetics, which was not known. We have lung cancer as the commonest cancer in Kashmir now. For a long time, it used to be the GI cancers. Now it is the lung cancers. And lung cancer could be rooted in a lot of environmental factors. And one of them could be air pollution. So contaminants that we have in our exposure. Breast cancer, beyond MMB is the commonest cancer that we have in the females. Beyond the genetic predisposition, there is a lot of other toxicants that are possibly being related to the development of breast cancer. So we need to understand this. Antimicrobial resistance to have been more talked about. It is the biggest pandemic that we have. We can't say that but that it's in such an extreme proportion, and that originates in animal health. And that is where WHO says that if there is one thing that should concern us all now, apart from pandemic preparedness, is the AMR. And we need to focus on it. And that is where Dr. Nazir Saab talked about this school of One Health that unifies all these sectors. So we need all to work together. All sectors have got to work together so that we coordinate. we communicate, we collaborate, and build our capacity for a good human being, good and healthy human being, a good and healthy animal, and an excellent ecosystem for us to live in. I congratulate you all for inking this MOU, developing this declaration by SKUAST that we need to have this concept of One Health that has got to be fostered and developed in our state like it has been done in many other developed parts of the world. So I wish you all the best. I wish you great success for this workshop that you're actually undertaking for epidemiology and statistics, which Dr. Gulati said is unfortunate that we don't have too many epidemiologists, we don't have too many biostatisticians in this country. And this is the need of the hour, because this is something that we have to harp on every single time we write a paper. So I congratulate SKUAST. I congratulate each one of you who has conceived of this idea, designed the primary draft for this, where I find lots of issues that are your research priorities, from comparative epidemiology to joint risk and assessment, emerging threats of infectious diseases, AMR, ecotoxicology, health disparities, food and food production safety. I'll tell you just an example that in winters, we sleep in hammams. So it's a personal experience. So I shifted from hammam to the room upstairs after the winter was over. And I started off noticing that I get itching over my forehead, and so did my spouse. I did not understand anything. After Fajr, I would look at my mobile phone and look at the news or whatever I had. I would find some tiny dots that would move. This has happened this year. And I could not understand what has happened. So I was trying to take antihistaminics for my itching. It did not work. But these tiny dots were a surprise for me. I could not understand what's happening. I looked at the AC on top of my bed, and there were some tiny dots even on the AC. I collected them. Talked to Professor Nazir, told him that I have these tiny dots. I want to find out what they are. I need a microscopic help. He referred me to his entomologist. I forgot the name, I'm sorry. Then, and I think I found out that these were actually pigeon mites. Then there was a pigeon, this nest, which was outside on the external component of the AC, and these pigeon mites had gotten in. And then I could find that there are reports of pigeon mite induced pruritus that can lead to scratching. I took care of the pigeon nest and sprayed the AC as well as my bedding with the insecticidal sprays, and the pruritus was gone. So this would be probably the first report of mobile phone having detected tiny dots, and tiny dots having been related to pigeon mites. So this also signifies interdependence of one field on the other. I mean, if I had not Dr. Nazir Saab's phone, I did not know, he would not tell me that it can be seen under the microscope, and under the microscope we could find out that it was actually a pigeon mite. I would never know what is actually affecting me myself. So I think this all is a unifying concept. I congratulate you, Dr. Nazir, and your whole team for having thought of this idea, executing it so beautifully, and I wish you all the best for the deliberations and subsequent course of action for your One Health program. Thank you.
Thank you so much, sir, for sharing your outlook. And we thank you for your dedication towards the healthcare system in Kashmir as well. Thank you, sir. It is ardent privilege to have Honorable Vice Chancellor SKUAST Kashmir as chief guest of the event, a man with a mission, leadership skills, and commitment to the cause to take the university from higher to highest, carving the phylactery of opportunities, vision to promote exchange of research, academic knowledge, and skills, involving young minds to cultivate and nourish ingenuity. Honorable Vice Chancellor, SKUAST Kashmir is leading and guiding the university to the pinnacle of achievements. With this, may I take the privilege to humbly invite Honorable Chief Guest of the event, Professor Nazir Ahmed Ganai, sir, to grace the podium and share your enlightening vision.
Thank you, dear. Your name is? Nuzhat ji. Thank you, Dr. Nuzhat. We have with us a hardcore physician and a hardcore medical researcher. So it is a rare combination, especially in our part of the country. I know that a physician and a researcher, Dr. Parvez Ahmed Kol, the director of the Sher-e-Kashmir Institute of Medical Sciences here in Kashmir. One another very important person related to this particular event is our Dr. B.R. Gulati Sahab, who is the director of the ICR Institute, Nevedi, and our very revered guest from United Kingdom, Dr. Shiban Moore, who is the reader of the One Health, which is the topic of our discussion today, from the University of Liverpool. I have with me my director, extension, Dr. Dil Mohammad Makhdoumi, the dean of this faculty, Dr. Tufail Bande, the organizing secretary, Dr. Ejaz, the heads of the departments, the faculty, and I see some of our past alumni of this college. I believe many of you are from here only. My dear students who are here on this row. And of course, I just forget, we have one very important person in this meeting, Dr. Salim Khan Sahib, who is the head of the community medicine, forms the important component of this topic of discussion. Assalamu alaikum and a very good afternoon to all of you. Let me first compliment the dean of this faculty and his entire team, and for conceptualizing this program, which we are just discussing today, and which is of immense importance, as has been discussed and debated. I would also thank Dr. Kol Sahab and Dr. Shiban Moore and Dr. Gulati Sahab and Dr. Salim Khan Sahab for kindly consenting to be part of this discussion. I would appreciate that before this onset of this meeting or this inaugural session, you had some interactive session with the stakeholders to see the need to institute the School of One Health here, and I believe that you must have debated it at length to see that how important it is and how should we move forward, and that will make our job easy. And I would also compliment the organizers, the dean, that you are making this event an outcome-based kind of an event today. The outcome means that you have this SKUAST declaration on instituting the School of One Health on one side, and we have also signed some MOUs with our partners here from SKUAST, from Nevedi and the School of the Community Medicine about collaborating with each other. So that's another very important outcome of it. So I believe this is the practice which we are developing in this university. A couple of days before, we had the vice chancellors meeting in this university. Some 42 vice chancellors from different countries of the country, parts of the country had assembled here. And that time it was under discussion that how should we share the national resource amongst us? And it is being debated and talked across the country that we should do it. And because India is a very, very big country, very extensive country, and there are many institutions who have some inborn strengths, and then unfortunately there are other places and communities at different locations, remote locations, who don't have access to them. How should we do it? And it was just being only debated and discussed. But then on that day, we came up with what we call as the Srinagar Declaration, wherein 32 vice chancellors would sign on one single document as to how should we share our resources, our strengths with other institutions. And that also includes that how should we initiate the program of the postgraduate program in sandwich mode, and how could we also share information on research and student faculty exchange as well. I would also compliment this faculty. We talk about COVID, and as rightly said by Dr. Salim Khan Sahib, that when COVID would strike us, we were not really equipped at that time to handle the COVID situations. But I'm very happy that from this college, we had deputed a team of my faculty and our research scholars to the schemes. And I'm pleased to say that before the onset of the COVID, we were really equipped with that kind of the diagnostics in RT-PCR, trying to just see those, identify and do the diagnosis of those infectious diseases. And that time it would come, those guys could also help our, fellow colleagues in the schemes. There are some guys here, and sir, telling you very honestly, all of those guys who were there in that medical institute that time working during the COVID period, all of them suffered acute and severe COVID infections, and it was really great thing for us that they would recover. Otherwise, they did suffer. I would compliment them, and that speaks something about this joining hands together. And let me also share with you, this is the faculty, or this is the college who would organize the first international conference on COVID in India, and that too in Kashmir at SKUAST-Kashmir. So these are basically the indicators of my faculty being proactive on certain accounts. And so is what you are demonstrating here. And if we speak about the relevance of this whole about this One Health concept, or this epidemiology, or this biostatistics, we can just put some little bit of a light how India has progressed since independence. It has progressed almost in every field. Only a couple of days before, we have landed on moon, and that has given tremendous strength to the India in the international community. But besides many other fields, it has also tremendously progressed in medical education and in agriculture as well. I believe that most of us understand that in 1947, our average life expectancy was around 27 years. Now it has gone as high as maybe 70 and 76 years. So we must compliment our health professionals in India who have raised this expectancy to here. And not only that, India is now being converted into a wide destination for the health tourism and for the kind of the infrastructure we have here in India. And we have the world-class facilities. And it has been possible through the kind of the approach like the prophylaxis, the vaccine technologies, the treatment of those lifestyle diseases, and of course, the use of the antibiotics. But then, of course, the indiscriminate use of those antibiotics, as has been said by my colleague, has also set in some new challenges for us. So if we talk about the agriculture, we have also grown tremendously. We have converted India. It was a food deficit country in a food surplus. We were producing just 50 million tons in 1950s, and today we are producing 320 million tons. So we have gone by 6 times in food production because India was too deficit in food. And if we talk about the milk, it has also gone by 10 times, from 17 million to 200 million tons. And today India has a very good place in world's agricultural education and research system. And both these two sectors, the medical education and the agriculture, have bailed us out during that COVID period. These are only two sectors who were just working during the COVID period. And I would compliment both the two. That was a testing time for India, how it would handle 1.4 billion people and how would it feed 1.4 billion people. And that is the kind of the resilience India has demonstrated. But now is the question of bringing in the quality of life. We have been able to just raise the life expectancy from 27 to 76 years. And we have been able to also produce food, more food, from 50 million tons to 300 million tons. But then that food production is at the cost of our environment. And when my colleague was speaking about the incidence of the rising incidence of the cancers, especially everywhere. Maybe in Punjab it was earlier because that effect of the impact of the Green Revolution was felt first in Punjab, and they would use in rush for improving the productivity those kind of the organophosphorus and agrochemicals, and that famous cancer train here. And then lately we started, this agriculture sector picking up in Jammu and Kashmir, especially the horticulture sector. And we are, using these organophosphorus chemicals to a larger extent. And unfortunately, the incidence of these cases is rising too much. So therefore, is there a need for all of us from here on to start working on the quality of the life of our people? Let me share with you, my colleagues. If you'll go your website of this university and see the slogan of this university, that talks about this university stands for the quality of life of its people. We don't just simply bother about the availability of the food to the people. We don't just only talk about the improving the livelihood or the economy of our people. We don't also only talk about providing some employment to our people through agriculture, but the bigger goal is that how do we work together to provide the quality of life to our people, and that we all of us understand. And when we talk about that, we therefore must understand that host pathogen environment interaction. I believe I do not just speak too much at length to you. You all of you understand. But I would only cite one small example. I was in University of Wisconsin, sir, and what happened during those days? One person was brought to the hospital in the University of Wisconsin, and he was suffering from diarrhea. You call it loose motion. And when that patient was taken to the hospital for his ailment, his complaint about this loose motion, what did the doctors do there? They did not take it as a case study and then would go some kind of a symptomatic treatment to the patient and would give him some antidiarrheals and maybe some antibiotics, maybe some to treat his enteritis. What they would do, they would do this kind of a reverse engineering. They will go and try to track down the source of the food that person has eaten. And they will go first to the food store where from he has purchased the food, and from food store, they will track that particular farm where from that food was being produced. And they would identify and locate that food was being contaminated by some kind of the municipal waste. And what they did, they would just stop that supply chain of that contaminated food right from the source, because they would identify that this is an indicator for them, that one person having enteritis is an indicator of some kind of a bigger kind of a challenge for them. That's how do they handle these kind of diseases. And that speaks something about that interaction between the host, the pathogen, and the environment. So that's how we have to just move forward. And at the same time, we also see this climate change looming large on us, and the weather vagaries, and then you see these emerging diseases and the pests happening. And once there is climate change and the new pests and the diseases are emerging, what do? We go for use of all the kind of the agrochemicals to combat them. Then again, we have to see that how do we mitigate on one side the climate change, which of course the countries like we in India may not be so effective, but at the same time, we have to build our resilience to see that how do we reduce the impact of this, and how do we handle those emerging diseases. And let me share with you that we have a program under this Holistic Development of our Agriculture Policy, which is a program. We have one of the programs on reducing the pesticide load on our plants, on our crops. And as has been rightly said by Dr. Dil Mohammed Makhdoumi, say, for example, he has given a very small example. If you use the drone technology, that will help us in reducing the amount of the pesticide we spray on our plants by almost 80%. So would be reduced. But at the same time, we are endeavoring in this university to come up with those biocontrol agents, the organic fertilizers, kind of the things which would again not only reduce the impact of it, would also improve the health of the soil. And taking all of these together, we have to just go with the technologies of the 21st century. And we all of us understand this is an data-driven age, and that data-driven age is being facilitated by information communication technology. And if we want to really connect the dots, all of us together, we need to build our capacity into it. For example, we are now building the applications in agricultural sciences for providing those weather-based and AI-driven advisories to the farmers, which are the crop-specific and the location-specific advisories to the farmers. And same is the case we are also to do with this animal disease monitoring. And let me share with you, in order to reach there to build our capacity in our university, we could be among us the first agriculture universities who are formally going to have its own artificial intelligence and machine learning center, wherein we would be tremendously building the capacity of our students and of our faculty in the coming days. And let me also share with you, we are also going to strengthen the bioinformatics center in this university, because ultimately when we talk something about biostatistics and we talk about the epidemiology, unless you are very proficient in the advanced biostatistics, what we also call the bioinformatics, you can't just go without it. And at the same time, I am also, I believe my colleagues would know it, but to my guests from outside, we are building our capacity in hardcore R&D. We have the capacity for gene editing in this university, the CRISPR-Cas technology, and many of my colleagues are doing it. And I am pleased to just share with you that this is one of the few universities in India who are working on multiple number of vaccines. 5 vaccines we are working together, and most of those vaccines are the genetically modified vaccines. And at the same time, we are building our capacity in genomics and transcriptomics and the phenomics. And you must have heard also about the speed breeding technologies. And that phenomics is one very important component of the speed breeding technologies. That is how we are trying to shape this R&D ecosystem in this university. At the same time, we are also encouraging our students and the faculty towards being more creative and more innovative. And I believe that you would be many of you would be agreeing to the fact that we are again the first university in the country, especially amongst the agriculture universities, who have built the most vibrant ecosystem for innovations and startups. And today, we have some 20 startups, and some 15 are registered as private limited companies by our students. And of course, they have the challenges. My startups, the young startups, have the challenges. I was in Israel the last year, and I was believing that any startup coming in Israel would be a success overnight, maybe with low failures. But in Israel, they would say that 85% of the young startups have the chances of failures. So my dear friends, if someone of you would tell you that this university had told the other day that we have 20 startups and they maybe only 2, 3, 4 are working. If 4 are working, that means some, what would be the percentage? 10%. That we are better than Israel and maybe at the country level. And if you see the figures at the national level in India, 90%, 95% of the new startups, they have the chances of failure. But then what do we mean by failure? They will just go in hibernation for a couple of time, maybe for a couple of years, come back and then rise again. So those are some of the strengths we have built in our university, which has placed us very differently than many universities around the country. And I hope that the place which we have carved out in Indian agriculture education research system, we will just continue to ride on that and see that our model of education becomes common in Indian agriculture education system. And the vice chancellors of the different universities who keep on coming to this university, they have a couple of purposes. One is that they would like to come to Kashmir, a good place to visit, but at the same time, they are coming here